Our next presenter is Dr. Benjamin Nongram, and Dr. Benjamin is going to present on glaucoma burden and its profile in a tertiary care center of Northeast India. Over to Dr. Benjamin.
Respected members on the dais and my dear colleagues, my presentation is on glaucoma burden and its profile in the tertiary care center of Northeast India. Glaucoma is a form of progressive optic neuropathy where of the known risk factors, raised intraocular pressure is the most common. Now, it is the fourth leading cause of moderate to severe visual impairment and the third leading cause of blindness. The objective of the study is to describe the profile and distribution of glaucoma. Coming to methodology, this is a retrospective observational study, retrospectively from 2016 to 2014 and prospectively from 2017 onwards till 2022. Sampling type, all consecutive patients that were diagnosed with glaucoma. Now, glaucoma were diagnosed based on the operational definitions laid down by ISGEO and CGRN. Now, the methodology involves that all patients that attend OPD are routinely screened for the vision, refraction, IOP, and fundus examination. Now, all patients that have any suspicion findings, then they would undergo a detailed examination as for any patient in order to diagnose glaucoma. Now, glaucomas are diagnosed based on the level of evidence. The level of evidence one, when there is visual field finding which is appropriate or which is correlated with that of the this finding and which suggests of glaucoma. Now, the level of evidence too, when the field are not reliable, but when we are able to see that there's a cup disc, especially the vertical cup disc ratio of more than 99.5th percentile, which is more than 0.9. And the level of evidence 3 is that when there is, when the visual field is not possible or the cup disc assessment is difficult, so based on the level of IOP, which is more than 26 millimeter based on the 99.5th percentile. The study was approved by the Institute Ethics Committee. Now here are the results. Over the last 9 years, we diagnosed 449 patients of the 89,000 plus patients that we have seen, new patients. Now we have divided into two groups. Now less than 40 years constitute to about 20%, while 40 years and more is about 80%. The distribution in 40 years and more is that POAG is the commonest one, and followed by PACG, and this is quite significant in female. The association p-value is less than 0.001. In less than 40 years, JOAG is more common, followed by secondary open-angle glaucoma, which are mostly because of trauma, angulation, or uveitic inflammatory in origin. Family history just contributes to about close to 5%, which could be either of the parents. Now hypertension leads, followed by diabetes. What is interesting is COPD. We found that quite a significant number of COPD have the risk factors as the risk factors, and also hypothyroidism and CAD. The discussion is that the prevalence is somewhat lesser, though it is a hospital-based study compared to other hospital-based study in India. Population-based showed about 2.5%, other hospital-based showed about 5%, but ours is only 0.5. Probably because we have included all the age groups, and probably because it is in the high altitude with the lower atmospheric pressure contributing to lower IOP. COPD, the shared risk factors, there is risk factors of more than one. Probably the observed effect could be attributed to shared risk factors like advanced age, smoking, vascular dysfunction, and steroid usage. And CAD also have the high risk of developing glaucoma and vice versa. As for hypothyroidism, the proposed mechanism could be because of the deposition of hyaluronic acid and mucopolysaccharides within the trabecular meshwork. Conclusion is PACG is high in our part of the country, which is similar to that of population in China and Japan. And systemic conditions like COPD and hypothyroidism should also be kept in mind whenever a patient comes to OPD. Thank you.
Thank you. You got quite a high percentage of patient under 40 with glaucoma compared with the known parameters. And do you think, have you taken the history of steroid use in all this patient? Because one of the factor could be non-COPD related steroid use over the counter for skin condition and all that.
Yes, sir. So most people in the Northeast, they smoke from early age. That could be one of the contributing factors. Not really COPD. COPD we see mostly in age more than 40 years. But I think it is the smoking that does that contributes.
Smoking is
Smoking, most of them start from the age of 18 years, 15 years in rural population.
Thank you. Okay, thank you very much. Thank you.